Hello there. I'm Lena. Nice to meet you all. Today I'll be explaining World Antibiotic Awareness Week, which is also known as WAAW. The WAAW 2021 campaign will encourage stakeholders, including policymakers, human and animal healthcare providers, farmers, and the general public to recognize that everyone can be an antimicrobial resistance (AMR) awareness champion. Did you know that World Antibiotic Awareness Week is celebrated from 18th November to 24th November? World Antibiotic Awareness Week, or also known as WAAW, was first started in 2005 to promote more on global antibiotic awareness. The World Health Organization, WHO, recognizes AMR as one of the top 10 global public health threats. A previous study suggested that death attributable to AMR would reach 10 million by 2050 if no action was taken. For this year's WAAW is spread awareness, stop resistance. AMR should be taken into consideration as AMR can cause resistant organisms to lead to treatment failure. When bacteria become resistant to an antibiotic, it means that the antibiotic can no longer kill that bacteria. AMR also causes an increase in motility. Besides that, resistant microbes can cause spread to the community. This will indirectly add more burden to the healthcare cost, as the community will suffer from this disease, which sadly leads to death. It can also lead to selection pressure. Bacteria that have acquired a random change in their DNA that allows them to survive in the antibiotic's presence outgrow non-resistant bacteria. Now let's look into the causes of AMR. AMR can be caused due to lack of hygiene. Poor hygiene and sanitation can lead to the spreading of infectious diseases, which lead to an increase in the usage of antibiotics. AMR can also be caused by overprescribing antibiotics. Next, the lack of new antibiotics being developed is also a major source for this issue. A low amount of new antibiotics leads to AMR, as there is no cure for the spread of resistant bacteria. AMR can also be caused by poor infection control in hospitals. Prevention is better than cure. So these are some of the ways to prevent AMR. Firstly, do bear in mind that always seek for medical advice when you are ill. Apart from that, always take prescribed antibiotics which have been verified by healthcare professionals. Next, always remember to complete your drug regimen even though you are fine, as if you don't finish your antibiotics, it can lead to rise of antibiotic-resistant bacteria. Always remember to wash your hands and yourself clean. Are you curious to know how resistance spreads? Well, antimicrobials are given to food-producing animals, and these drug-resistant bacteria develop in animals, which indirectly can spread to the environment. This can be transferred to the people by eating food. Infections from drug-resistant bacteria can be severe and difficult to treat compared to those suffering from drug-susceptible bacteria. Healthcare professionals play a huge role in combating AMR. As a healthcare professional, always remember to maintain hands, environment, and instruments used are clean to prevent the spread of bacteria. Always prescribe and dispense antimicrobials that are needed. Do bear in mind to prescribe antimicrobials with the accurate dose and duration. Lastly, always confirm with your patients on which type of antibiotics they need. So, it's time to take antibiotics seriously. Always think twice and seek advices. To handle antibiotics with care.